People like Barbara have given their life and their time and their talent and treasure to do this. And she's been in this. She understands what's at stake here. The humanity of the unborn, caring for the mother, the pregnancy centers. But the reality is, we fail. The problem's us, as Pogo says. I met the enemy and the enemy is us. We don't care enough. Doctors in most communities don't support pregnancy centers. It's very hard to get a pregnancy center, to get a doctor, to see a patient regularly, or to see them on a Friday afternoon or a Thursday afternoon, or that Monday morning squeezed in between patients. I know because I was there. So I have a big problem that the pregnancy centers are doing these in the first place, even though we support a medical model pregnancy center. It's not my choice. That's why I want to inspire docs to go into pro-life work and help see the pregnancy centers. Because remember, most women don't come in on a Thursday and have the abortion on a Friday. There's time. You can get them to be seen. We see them throughout pregnancy. We actually go to the community to help fund that. So I want to support you and say, yes, it's very important. But as time goes on and abortion becomes more common and more accepted, it's a backup to a contraception, basically. And you can show me all you want, but the focus groups say that what converts women, sometimes it's the humanity of, so you have to use all these approaches, don't get me wrong. You know, Martin Luther King talks about this, those ways of, you know, engaging the community. We must always, at every, you know, like in our practice, we talk about the unborn child. We talk about when we do the ultrasounds, we ultrasound all those women who come in. Because in our neck of the woods, they send us only the abortion-minded women. They say the ones that are not abortion-minded, they send to other places. Because we have a pretty much of a long track record now. And so I want to thank you for your comment. It's just been frustrating to me that after all these years and after all this technology and after all this, we still talk about, people understand the human, it's a real challenge because they still want determination. And I think we would do a disservice if we didn't talk about the humanity of the child. One of the interesting pieces of the puzzle here is of the lawyer, Matt Bowman, from the Alliance Defense Fund, ADF. When you listen to him talk about this issue of informed choice, it's this whole idea that it's got to be part of that stool. You have to have both. And I apologize if I emphasized one over the other. I just know what works in our office. And that's talking about the service we provide of actually walking them through their pregnancy. In fact, just recently, I had a young woman come back after her abortion. And she had the abortion on Saturday, and she was in our office on Tuesday. And she says, Dr. John, it was like surreal. I saw this woman's long fingernails holding my shoulder. And I work in the healthcare industry, and I'm pro-life. And I wanted to tell her, you know, in real operating rooms, you're not supposed to have fake nails. She said there were these 2 students who were doing their internship at the local abortion clinic. And she says there were 2 older women in their 60s going, don't you love it here? And both pro-choice students, interns, said, I wouldn't say love it, it's interesting. And they said, oh no, we love it here. She remembers hearing that. We welcome women back to our office after their abortion because, once again, we don't try to turn our back. We can't walk you through it. I don't think it's a good decision. But if you choose that, you are always welcomed back in our office. It's that idea of connecting. And that's after showing them, do a lot of people get sick? Do a lot of people keep their child after seeing the fetus, seeing the baby? Absolutely. There's no doubt about that. But I think we can do a better job if we really integrated the two and get doctors to really step out and say, we really want to practice better medicine and work with those centers that you so well represent. And so, no, I thank you for your commentary because it's, I misspoke. So thank you. Yes, ma'am.
My question is really twofold. What are the biggest challenges for people who are going into the medical field, whether they're nursing or doctors? What
Yeah,
for an abortion. Just what advice would you give?
Oh, wow. I think, like President Obama said at the prayer breakfast, when you get challenged, be true to your conscience and true to your God. Because in the end, eternity may be at stake, if you so believe that. The biggest challenge as a pro-life medical student is that when you enter the world of OBGYN, abortion is just considered what you do. And either you must give, or you must do it, or you must refer. And when you say to them, no, it's a challenge because you've got to stand up, and yet you're wet behind the ears. I remember how much I stayed quiet during those years. I did it because I believed it was good. And then after a while, I just kind of kept quiet because I felt awkward. But now there's more and more of us. And you begin to talk to your peers. And that's why this group is so important, because Students for Life, or medical students for life, is to help build that collegial camaraderie, that you're not alone, that you're not alienated. And you know what? If you look at the data, there's really good data to support what you're doing. And you're respecting the right of the person. You know, there's all those issues. And so one is find those mentors. So if you're in the healthcare industry, take our number and our card down. Talk to those people in your community who are those docs that support those pregnancy centers, who the Right to Life of North Carolina knows. They're willing to help you. The other issue of Plan B, and once again, it's an act of conscience. There are many, many other pharmacies around who will provide that service. And once again, it's really up to you, because once again, more and more people are being compromised. Whether it's the Vanderbilt nurses, or that Filipino woman at Mount Sinai, being coerced, no, you must do this. No, I think you follow your conscience. And so one of the most biggest challenges is make sure that you all examine your conscience on this issue of life. How far do I go? Am I really pro-life? How far do I go in that? Do I not believe it for myself, but I really can't tell someone else that they need to do it? Let me tell you a story of what happened to me in my residency. A woman comes in with an AFP test. That's a test looking for a genetic anomaly in a child. Her age gave her a risk of 1 in 3,000. We did the test, and the risk was increased to 1 in 1,000. I looked at her and I said, guess what, Terry? Your risk is elevated, but it went from 1 in 3,000 to 1 in 1,000. Not that much. Her boyfriend goes, oh, Terry, this is great. Terry looked at me and said, no, it's not great. I can't take that risk. I want the termination. And because I was the OBGYN there with her, I did it. That child was healthy. We terminated that child at about 17 weeks. Because once you start doing it when that person asks, there's a great article in last week's Journal of the American Medical Association. And the title of that article, and of course I'm probably not going to find it here, was it was a study looking at how the right to your autonomy as a provider comes in contact with the right to the autonomy of the patient. Where do you draw that line? Where do you draw that line? And they list many, many areas due to efficiency or mission or finances or conscience where your autonomy is just as much right to be present as their autonomy. It's in JAMA, it was last week. It was a very well done critique from an ethical dimension. So that's the biggest, is to I want to encourage you, or encourage those, to not be afraid when they engage the system. Because the reality is that you're going to find more and more people agreeing with you, but many of the professors and teachers in the community on this issue are very much pro-choice. And they can't imagine how you could not offer this. So it's in that conversation that we can help. Yes, sir.
So, So in all fairness, I was the co-chair of the Planned Parenthood group at
Oh, good.
UNC last year.
Okay.
So I'm not necessarily here to argue or anything like that, but
No,
I
go ahead.
just have a specific question that I'm interested in.
Go ahead.
You talked when I came in about the link between abortion and cancer.
Breast
And I know that is something that the pro-life and the choice movements have talked back and forth many, many times about. We've seen many studies come out. I really like to cite the American Cancer Society because I see the Cancer Society as a really unbiased organization that doesn't have a specific agenda around abortion.
Right.
And the Cancer Society has said there is no link between abortion and breast cancer. So I'd like to hear your thoughts on that or challenge your statement.
No problem.
Your response.
No problem. Janet Darling at the National Cancer Institute. This is their data. This is the study you're quoting. And this is found in, this one was found in 1994 as one of the many. I can give you the incidence. There's an overall 50% breast cancer increase by the age of 45 who have had an induced abortion. 12% lifetime risk increases to an 18% lifetime risk for breast cancer. There are certain subgroups of that title. If you have a family history, it's an 80% increase. If you have an under 18 abortion, it raises a 100% increase. And if you combine family history with under 18, 12 out of 12 women out of 1,800 studied developed cancer before the age of 45. The reason why she said that, and the reason why the national, once again, I thank you so much, man, first off, as a guy, to be the president or the chairman of a Planned Parenthood group. I've got to tell you, it's not just a woman's issue, it's a relational issue. And so I appreciate you doing that, even though I may disagree with you. I used to work for Planned Parenthood. I used to be a part of it. And I understand, but this is what I'm talking about. And this is where that study from the National Cancer Institute, the subgroups are looked at. When you look at family history plus first abortion under 18, out of 1,800 women, there were 12 women who fit that category. All 12 developed breast cancer before the age of 45. But because the number was so statistically, it was insignificant, because the number was too small to be statistically significant. That number is too small. What was your first name, buddy?
Lee.
Lee, John. Lee, that number was statistically too small. So when she says that, or when the NCI says that, they're technically right. But they're kind of, once again, this ideological debate about abortion, I just don't understand why the pro-choice side or the pro-abortion side says there are some risks to the procedure. That's the part that, and don't let the pro-lifers get away with their criticisms either, Lee. I mean, I'm here to, be right with you. I'm convinced that when you take the NCI will say that one of the, how do they say it? That there are two, I want to get this straight for you. There are two pregnancy-related independent risk factors for breast cancer established in the medical literature. One is the protective effect of a first full-term pregnancy. See, this is what's really interesting, is because, so the decision to abort and delay pregnancy culminates in the loss of this protection, and the net effect is an increased risk of an induced abortion. I mean, then there's a net increased risk of having breast cancer. And that comes from the World Health Organization's bulletin. Remember, we all know that there is a protective effect of having a first full-term infant. That's statistically, scientifically proven. If you interrupt that, watch what happens. And this is my explanation for it. It's not just, I'm not trying to push an agenda here. The numbers are still small, but it would be adding 5,000 new cases to the abortion. Let's just say that the pro-lifers are right. That means that there's 5,000 women out of the 190,000 are there because of abortion. Right? That's the big statistical numbers. What happens is that when you have a pregnancy and those estrogen and progesterone